everyone. Today we are going to see about a wound healing process. First, what is wound? Wound is a break or a damage in the tissue caused by the injury, which may lead to a bleeding, pain, or risk of infection. Healing is the natural process of which body repairs the damaged tissue after an injury. It involves the clotting of blood and regeneration of cells, formation of new tissues, and restoration of the normal function. And what is wound healing is a complex function, and it involves 4 phases. First one is hemostasis, inflammation, proliferation, and remodeling. First, what is hemostasis? It is the first stage of wound healing where the body stops bleeding immediately. It begins after an injury. First, the blood vessels are constructed to reduce the blood flow in that area. It minimizes the blood loss, and platelets are activated to stick the injured site, and clot formation are activated, and so that it minimizes the blood loss in that wounded area. And that clot acts like a scaffold or matrix. It allows the inflammatory or repair cells to migrate to the wounded site. And this is the picture of hemostasis. First, the blood vessels are constructed, and the platelets are arrived, and coagulation factors are activated, and fibrin clots are happening, so the excessive amount of blood loss is minimized. And second one is inflammation. It is the protective response after hemostasis. Here, the damaged cells and dead cells are digested by the white blood cells. First, the blood vessels are widened to increase the blood flow to the injured sites, because it brings the nutrition, oxygen, and white blood cells to the wounded area. First, neutrophils arrive first to kill bacteria and clean the wound. After 2 to 3 days, the macrophages replace the neutrophils, and it digests the dead cells and release the signals for the next healing phase. And during the inflammation, we have some signs of inflammation, that is redness, heat, swelling, and pain. Then the macrophages releases the growth factors and attracts cells for tissue repair. And it typically takes 2 to 5 days depending on the size and our overall health of wound. And this is the picture of inflammation phase. And next one is proliferation. It is the phase where the body builds a new tissue to fill the wound. It involves the cell growth, blood vessel formation, and wound contraction. First, fibroblasts are activated to produce a collagen. Collagen forms the framework of new tissue, and granulation tissue formation are activated. Here, the granulation tissue is a soft, pink, red, and bumpy. It fills the wound and supports new blood vessels and cells. In proliferation state, a new blood vessel formation are happening. Here, new capillaries are formed to restore oxygen and nutrition supply, and new skin formation also happening, and also they cover the wound with a new layer of skin. And wound contraction, like myofibroblasts pull the wound edges together so that the wound shrinking. And the remodeling phase is the final phase of wound healing. It is the maturation. It is the final phase of wound healing where the new tissue is strengthened and organized. The wound fully closes, and the skin and tissue returns to as close normal as possible. And here in this phase, the collagen remodeling are happening, the scar formation are happening, and blood vessel maturations are happening. Newly formed capillaries are reduced, and the area returns to a more normal blood supply. And at the end of this phase, the tissue regains its 80% of its original strength. So that first in hemostasis happen after an immediate injury, but inflammation happens 1 to to 1 to 5 days, and proliferation happens in day to weeks, and maturation happens week to month. They are very important for wound healing process. Thank you.